There shouldn't be any barriers, though. I mean, put all of this aside for a second. Put down facts, the medical jargon, everything. There shouldn't be any barriers. If you go to a licensed clinical professional that you know is licensed and medically trained to do a proper assessment and go through the entire motion to make sure that you are alive and well, there should be no barrier. You should be able to ask whatever question you want.
You're listening to the Boundless Authenticity Podcast, where we discuss everything related to the evolution of human consciousness.
At the very least, people need to understand that the United States builds bunkers, which are basically cities underground, every 3 months.
Basically, when you dream, you tap into your subconscious. It is your nocturnal intuition, your creativity and imagination unchained from conscious reason, ego and logic.
They're biologically alive, but they have no soul. They have AI consciousness. They can alter your conscious and the brain to get the brain.
We live in a multidimensional reality, whether it comes through esoteric information in the spiritual realms or the UFO people, experiencers, or mainstream through quantum physics and through mainstream science now realizing that parallel dimensions probably exist.
We're all spiritual beings. We're all having these human experiences. We've heard that phrase over and over and over. But what does that really mean? You know, all the big questions of life, we have these answers inside of our soul.
We're ultimately studying the nature of what it is to be human, good and evil, our psychology, how we think, our health. That's why I love Bruce Lee's great quote, all knowledge is ultimately self-knowledge.
The Boundless Authenticity Podcast. Prevention starts the moment you notice a pattern, not a symptom. What if the key to kidney health isn't better treatment, but better prevention? Today's conversation challenges the crisis-first approach to kidney disease and asks a more fundamental question. What if we actually understood our kidney health before something went wrong? I'm joined by Jennifer Williams, founder of Kidney Contenders, a prevention-first educational platform that's rewriting how we talk about kidney health. Based in Austin, Texas, Jenn has built something rare. A science-literate, culturally fluent resource that translates complex kidney health concepts into actionable guidance for everyday people. Jenn brings a systems-minded perspective shaped by her own experiences, regulatory insight, and a deep commitment to community empowerment. If you've ever felt lost in medical jargon, dismissed by healthcare providers, or unsure how to advocate for your long-term health, this conversation will offer you some clarity, dignity, and practical next steps. You can learn more at kidneycontenders.com. You can also contact Jenn at kidneycontenders.com. So Jenn, I'm happy to talk with you. Tell everybody how you got started on this journey.
Well, thank you so much for having me on today, Jahan. And I can tell you that it was a roller coaster of a ride. I started my career in healthcare, working in the payer sector in behavioral health insurance. And it was because of a family member, my mother, who was told that she was unhealthy. Her kidneys were shutting down. She needed dialysis. She had never heard of the word before. We had no prior family history of having any type of kidney failure. And she called me up at work one day and said, Jenn, I have been told this information. I have no idea what I'm about to face. Help me. And as soon as anybody in my family, a stranger, comes to me and says, help me, I want to help them. But I don't want to just tell them, okay, turn to chapter 1 of this dialysis manual to learn more about it. That's not how I operate. That's not how I synthesize information. And so when I told her I would help her, it meant stop working in the payer sector of healthcare, find a job working in dialysis, and learn everything you can to help your mother.
So what systemic gaps in the healthcare communication styles and the whole system and their way of setting up solutions actually inspired you to build an entirely prevention-first model and education platform?
Well, I think it was when the payer system, when I was working dialysis, and the people working in the payer system said, what's the point of early detection? I mean, all we want to do is make sure that these people that are on dialysis stay on dialysis, and we just supply them with the basic insurance benefits. And then if they're lucky enough to get a transplant, so be it. I think it was having that type of information presented at ground zero, working in dialysis, that made me realize, oh, wow. So we don't care about, or we, in quotes, we don't care if people actually want to know how to prevent their kidneys from failing. We don't care if people want to learn about their kidney cells. We don't care anything about that. We just want to keep them on dialysis as long as possible, knowing it's not a resolution. It's not going to resolve their kidney failure. And then we're just going to worry about what drugs we can give them. So that way they have a synthetic version of kidney health, but they're not going to feel better. And they're going to die probably quicker than if we maybe came up with preventative education to help certain populations that could be prone to certain comorbidities, certain defects, like diabetes, for example, that accumulates over 14% of the American population of adults in the United States. 14% of adults in the United States, roughly 37 million people that have diabetes, that are going to have kidney failure as a result of diabetes. This is information that primary care physician, that primary care nurse, they're not going to sit down in a clinic with a person and say, okay, Anthony, I hate to tell you this, but looking at how your lifestyle is based on these laboratory results, we think that you should probably care a little bit more about your health. No, we're not going to say anything. We're going to keep our mouth shut. We're going to let all this marketing material out there stay out there. And we're not going to try to make people understand that sometimes what looks pretty on the outside is actually poisonous on the inside. So it was an accumulation of working in dialysis, not liking how people were reacting to patients, treating them like just, things that can accumulate money for a center, or not real people that want to actually live. Just people that will tell the basic information to, you're already stuck with this disease, to heck with that. Well, what about their families? What about their children who come with them to the dialysis centers and see their mother or father, their uncle or their aunt, their sister or their brother being strapped to a machine intravenously, sometimes up to 5 hours, 3 times, 4 times a week, depending on their size? What about them? So they're supposed to think this is normal. And guess what? That's what they start to think. Oh, they're a low-level thinking population. Don't worry about it. That's not true. I met people who have PhDs who ended up on dialysis, some because of genetic reasons that predispose them to having certain ailments with how their kidneys functions, and others because of lifestyle choices, environmental factors. But it's not for me to tell you how to live your life. I need to show you.
That is madness. So they actually said, what's the point of early detection? All we want to do is make sure these people on dialysis stay on dialysis. And if that doesn't work, swap out the organ. What a great outlook on life.
You push a patient enough, you poke a bear too often. What happens when you poke the bear? If you actually have a dialysis patient, okay, say it's a person who has been on dialysis for over a year, because you can actually be on dialysis for more than a short period of time. Say you have a person who's sitting right here, right now in this studio, and they're looking at you, and you ask them point blank, how do you feel being on dialysis? Has anyone communicated your options? They, having been on dialysis for a year, having to be sitting in a chair and having to be fed a way of having their system cleaned, and not being able to move, not being able to have the freedom to do what they want to do, but feeling like you're trapped inside your own body. And this is the only way you'll be able to live. They're going to tell you exactly what they've been told and what they haven't been told. The little whispers inside the clinic, maybe from other patients, maybe from nurses, doctors, technicians. They'll even tell you about the ones who will sit down with them, try to have normal conversations, make the time go by fast. Not everybody tells them, oh, well, you're stuck here, so deal with it. Only the people who maybe are having a bad day, maybe they want to stick in that needle, in that site, a little bit too hard, maybe because they're just not happy that they have to work in the dialysis clinic. Or maybe it's another patient who just wants to make the world feel as bad as they do. It starts to feel like a prison mentality. That's authenticity right there. When you're faced with such a horrible situation where you're trapped in your own body and you're having to deal with people who will either talk over your head and use medical terminology you're not familiar with, or make you feel as if, good job, you keep staying and sitting in that chair. Just let us take over your entire health. It doesn't take much to get people to tell you exactly what they've observed. And that's what I observed. I not only heard language like that, both inside and outside of the dialysis facilities that I worked at, but also on the payer side as well. And I will tell you from the payer perspective, it depends on the type of insurance that the patient has. For example, one of the biggest headlines that I think a lot of people don't realize is that there was this end-stage renal disease prospective payment system rule that came out, which said that dialysis centers were going to be paid a higher percentage, a rate for the dialysis facility. Now, you would think, okay, that's a great thing. That means more staff, better equipment, cleaner facility, because listen, staff doesn't just include the clinicians. You also have to have the people that come in and do janitorial services. All of that is actually a part of those facilities. But then you wonder, okay, but is the payment that's going to be increased going to the facilities itself, or are they going to find a way to have the payments go for paying for other things that are not part of the needs of the patients and the clinical staff? And so that type of realization, once you've actually worked there at those type of facilities, when you've worked on the payer side, you start wondering, those claims that are coming in, that epigen that's been given to those patients, I want to make sure everything's actually not fraudulent related. So you start to see a lot, you start to understand a lot. But if you are that patient sitting there, sometimes 4 to 5 hours a day, depending on your size, depending on how bad your kidney function really is, it may sometimes seem even more like a prison. And then you start to acutely become aware of your surroundings. And it's difficult. It's extremely difficult.
For my own curiosity, are you aware of any statistics on how that particular method of dealing with the situation actually affects people negatively or creates poor quality of life? Do we know how many people are suffering?
So to answer that question, we would have to see if social workers, who would be technically they're licensed clinical social workers, but the type of work and their academic history is not really clinical based when you think of a nurse, a doctor, et cetera. They would have to actually do legitimate studies at the dialysis centers that they work at and take surveys on how people are responding to the treatment. There is something known as ICH-CAHPS surveys. They're the in-center hemodialysis consumer assessment of healthcare providers and systems. So it's the patient experience survey dialysis facilities have to administer, and they're administered by the social workers, to my knowledge. And they're supposed to take those surveys and understand and assess how patients are responding being in these dialysis facilities. But as far as having an exact percentage, what type of statistics and what it shows, it depends on how CMS takes those surveys in. But what I will say is those surveys, think of it like this. You have your surveys, you have the federal government administering the surveys through the certain personnel at the dialysis facilities. The surveys are then collected and then redistributed back to the federal government. How does the federal government actually assess those surveys? Do they just, put it inside of a machine and have a machine take away yeses, nos, maybes, and add a certain numerical value to it? But is it accurate? And when they were taking the surveys, was that accurate? Was that patient having a bad day? Or was the patient even given the survey? See, that's the other problem. I don't think we can measure those surveys accurately unless we start with a small population, meaning that every patient has to participate. And if the patient has to participate, they can't feel under duress. And the questions have to be generic enough to where the patient, if they want to add more information than simply a yes, no, or maybe, have the opportunity to do that. So no, we don't have anything I feel personally is concrete enough to say, yes, this is going to tell you exactly how those patients are being treated. And yes, this is what we can do to resolve that.
Let's talk about how cultural narratives around health, particularly in communities that are affected by kidney disease, shape whether people seek early testing or if they are just conditioned to dismiss the warning signs.
It is unfortunate. And unfortunately, as much as I don't like to mention this, but the African American community has the larger percentage of adults who are on dialysis as a result of having chronic kidney disease. And that is cultural influence as well. If we start looking at the urban environments versus the rural environments, we don't have that many rural environments left in the United States, for example. When you think of rural in terms of its actual definition, you have more urbanization than anything else. You have populations moving from state to state, for economic reasons, most cases. But what I can tell you, being a legitimate product of a multicultural background, my mother, who has African American descent, she, like I said, there was no family history of any type of kidney failure. In fact, her cause of it was unknown. But she did work in communities where it was heavily populated with African Americans. And I can tell you that one of the stories she used to come home and always talk about around the dinner table was, these kids, they don't care. They just want to, do whatever they want. They don't want to listen. They don't want to read labels, like little conversations like that. And so when I became older and I started working for different nonprofits, because I was a big thing in my household at the time, I worked in the education sector of them. So I worked for Kaplan, for example, when they had the supplemental education services sector. I worked and went to a lot of underprivileged, if you will, public schools. And I can tell you that it was a mixed reaction, in my opinion. I think that culturally, yes, there are certain foods, there are certain marketed materials, certain supplements, certain activities that are highly talked about, especially when it comes to the nutrition. But overall, I would say that it's actually a misconception that cultural influence is what's causing most population nowadays to have issues with their health. I actually blame most corporations for how they're marketing the information. For example, without naming any corporations, there are certain ones that have these pharmaceutical commercials that air occasionally during the hours when children and, some younger adults will be watching television, whether even if it's just like a commercial on a streaming service. And there are certain ways that they're marketing to these demographics using certain visualizations, knowing that sometimes the attention span is for 3 seconds. And they know just the right type of look to make it so pretty and compelling that they watch. And they'll use certain phrases over and over again. And then before you know it, that kid, that young adult, that adult is saying, wow, I want to try that. I want to do that. Never mind you, if you ever watch some of those pharmaceutical commercials, they'll say, and the side effects are blah, 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 really quickly. Let's make sure that that's out there because legally we're responsible for talking about the side effects. We're going to say extremely quickly in a very friendly tone so you don't think anything of it. Try it anyway. Try it anyway. That's a problem. So culturally, yes, there are certain conversations that seems like generation after generation after generation seem to have. And there are certain foods, there are certain drinks, there are certain just behaviors in general. Smoking sometimes is part of somebody's, cultural identity. And you have to be careful because if you say to someone, well, if you smoke nicotine, if you smoke tobacco, if you consume nicotine, you're going to get heart disease. Well, actually, you don't know that for a fact. You don't know that person's medical history. But should you have somebody who looks like they've never had any type of tobacco stain on their teeth, smiling and smoking a cigarette as your marketing campaign to promote what you're selling? Probably not, because anybody who does consume some type of nicotine, does smoke tobacco, they're probably going to have some type of stain on their teeth, even if they're veneers. So it's how we're marketing to people, that's the real problem.
So can you walk us through the psychological journey of someone who is noticing that they have a subtle symptom and then they actually try to get some help inside of this healthcare system that dismisses early concerns?
Well, I can walk you through my mother's journey, but I can actually walk you through my own journey. So this is something that I think a lot of your listeners probably don't know about me. And that is that I have a rare disease known as pemphigus vulgaris. Now, if I were to show you my lab results from the past 40 years, you would say, okay, how do you have any disease? I mean, your labs have no abnormal flags. I mean, you seem almost as close to perfect as a human being can be. What's the issue? Well, stress. Stress is a huge issue. And you know something? I never thought about any of this. And then one day I woke up, just like a lot of people, and I realized I didn't feel well. So when I don't feel well, I don't run to the internet and say, I don't feel well, help me out. I actually want to understand my body, how it works, how my mind works, how everything works. I listen to my body. My body one day told me, your throat is not opening as wide as it normally does. Maybe you should schedule an appointment with your primary care physician, who was different at the time. I did. They did their normal medical routine, said nothing was wrong. A week later, I couldn't swallow. And then after that, it just kept snowballing to the point where in 2016, I was in a very bad intensive state. And I spent the rest of 2016 practically dead. And what does that mean? It means I wasn't able to consume food. I barely got enough hydration. I was in such a bad state of being, and I was still working full time. I was a cripple inside of a living body, and all I wanted was proper medical treatment. I was told, oh, well, your lab results are not abnormal except for your white blood cell count. But we ran all these other tests and we've done some different images on you. And we can't find any tumors or anything else. And you don't have this type of disease. So we just think that you're probably going to die soon. So you should probably draw up your will. Yeah, okay, so I'm in my 30s and you're telling me this and I've never had a health problem before. But okay, yeah, I'll just roll over and die now. Thank you so much. It would take going to a very good primary care physician who a family member of mine was seeing to be diagnosed with pemphigus vulgaris. And then that diagnosis was 100% certified by an ear, nose, and throat specialist that primary care physician trusted and knew would diagnose correctly and take the time to look over the lab results and really ask me the right questions, learn about how my body was responding to, their quote unquote treatments or lack thereof. And then finally, seeing a very good dermatologist, because it's still, so pemphigus vulgaris is technically, in layman terms, it's an autoimmune disease, but it affects the skin. And so a dermatologist, of course, is a specialist for the skin. So it took 3 different people to finally help me get the right treatment. And all I did was go to a doctor, tell them my symptoms, be dismissed, despite the fact that I had no outside questionable activities like smoking, drinking, drug abuse, anything like that, exercise regularly, as plain as they could come. And yet I was still treated like I was just another body that was going to expire. That type of emotional turmoil can either make you into a very hateful person, or it can really make you want to do better with your own self. I always say this: if you want to know who someone really is, put them in the worst case scenario. I was facing death, Jahan. I was literally at death's door. I was scared to death, and I had to keep all of my emotions inside, which just accumulated stress levels. And so I took all of that experience, not eating, barely drinking, barely being able to function as a normal human being. And I said, you know what? And this is after I left dialysis. I have kidney contenders. this is all going through my head as I'm being told I'm going to die. I said to myself, I'm going to have Kidney Contenders be different. I don't care about any of these other kidney-related nonprofits. I'm not asking people for money. I want people's time. I'm going to find every single bit of education, put it together in a way that makes people want to learn it. And I'm going to trademark the name, and I'm going to trademark the image. And guess what? I'm not going to ask anybody for any assistance unless they want to give it. That's what I did. And there are people out there exactly like me. And then there are people out there who, guess what? You messed around with their health. They were just looking for help. Maybe it deteriorated their finances. Maybe it deteriorated their emotional state. And they decided to do something probably considered evil instead. But it's not for me to judge them. I just know I can judge myself. And I just know I can help people by giving them as much education as possible. It's not just about kidneys with us. It's about how their entire body works.
Well, gosh, I'm sorry that happened. I'm glad you made it through, though.
Thank you.
I guess, we got to talk about the specific regulatory or, let's say, medical literacy barriers that prevent people from understanding what's happening, from understanding their lab results, from understanding the jargon, all this nonsense that creates this information gap, which in the meantime, their disease is accelerating,
Yes. And there shouldn't be any barriers, though. I mean, put all of this aside for a second. Put down facts, the medical jargon, everything. There shouldn't be any barriers. If you go to a licensed clinical professional that you know is licensed and medically trained to do a proper assessment and go through the entire motion to make sure that you are alive and well, there should be no barrier. You should be able to ask whatever question you want. The question, though, is, do you have enough of the vocabulary, enough of the visual image to understand how to ask your question? It doesn't matter what language you speak. It doesn't matter what language is your predominant language. You can have access to everything you need, but do you know how to articulate it? And that's really what I'm noticing when people do reach out through Kidney Contenders website, the contact form, and they send emails to our team. Sometimes they don't know how to ask the questions. And we do our best to give them the answers based on how they have formatted words into questions.
Is there any part of you, based on your experience, that feels like some of these people don't really understand what they're even talking about, or that some of them may avoid using certain language?
I think in terms of systems. So when you ask me a direct question like that, I can't always answer you directly, not because I don't know the answer. It's just there's so many possible answers. I do think that I think people know more than they realize. I know that seems very like a fluff response, but I do believe people know more than they realize. I think people can visualize words, visualize concepts. It's just a matter of finding someone like me, like Jenn Williams, who's not going to laugh at you, tell you you're wrong, tell you you're stupid. Notice I'm using words that have been generational as well. People know more than they realize. They just have to respect themselves enough to know that what they think is right, what they think is probably healthy, they're probably right about. Very few people wake up and say, I'm going to do everything I can to kill myself. I don't think people really do wake up and think that. I don't believe that not in one iota. I do believe people want to be the very best versions of themselves. It's just that some people let emotional influences take more control over their cognition than they realize.
Well, that's true. And of course, I like to ask the questions that are going to go so deep you need an oxygen mask. So I had to put that out there. But also, as a hypnotherapist, one of the things that I hear quite commonly is, I had this diagnosis for this thing, and I just want to see if what you're doing can help me because I don't understand exactly what all of this means. I just know I got a bunch of terms thrown at me and some medication. And it's like that for mental health. And it's like that for people who come and they just want to lose weight, or they have some other illness and they have a fear around doing the thing that they need to do. So they're hoping I can wave a magic wand over that fear to help them cope. And I really have heard some of the most gruesome scenarios in the recent years in terms of people's health scares or their diagnoses and stuff. And people are dealing with a lot, and they feel now more than ever that they're going to these doctors, and these doctors are just either placating them or they're promising them something down in a future time that isn't going to happen based on a made up treatment that they don't even know the effectiveness of it. And that's one of the biggest things that scares people that talk to me sometimes about stuff.
I'm glad you shared that with me, Jahan, because I'll just say this to what you said. What scares me the most are the questions that we occasionally get about stem cell treatment. There are all different types of stem cells. Pluripotent stem cells, for example, which can become any other type of cell, like kidney cells. But we're not at the point where we know they'll repair a human kidney. Don't worry about dialysis. Don't worry about a transplant. Get a pluripotent stem cell right away. We don't have a lot of information. Even those with vast medical academic backgrounds. Looks pretty. Looks really pretty. And I'm not taking away from anybody's time studying to get those credentials. But are you then trying to make sure that all that knowledge and that license that you have, that you're telling someone else who may not have the same level of education and understanding the truth? Or do you have an ulterior motive? Are you getting paid by a company to promote a certain product? That's supposed to be done away with. I will say that. So it's scary just from a human behavioral standpoint to hear that there are people that are still suffering from that. That makes me actually quite angry. I don't like when people are objectified.
Yeah, that bothers the crap out of me too. And it seems to be a recurring theme. And I guess it has opened my eyes. And as time goes on, I get to feel like the way that people are treated is as if they are pigs for the slaughter. And that's just horrible. And I think that what you're doing is such a big mission. And I'm just curious, in the time that you started this journey and now, what positive shifts have you actually seen?
I know that our organization has made people who were already kind of curious about kidney health take an even more interest in sharing the information with the younger generations, with visuals, with the puzzles. It didn't dawn on me at the time, just for example, that puzzle building, it's both a visual movement and a mind movement at the same time, that would be appealing to kids and teenagers. And there are actually younger people out there who are starting to click on our website just to get the puzzle of the day. So something as small, I know that most people just want to feel good, and going to a website that just talks about kidney health, it can be boring, but we're interacting with people. We're giving them different opportunities to learn. I mean, we've even partnered with a non-monetary partnership because we don't collect any money. We don't ask for any money. We have partnered with different organizations, even some that are just, self-employed, who talk about wrestling all day long. But they also love talking about the health aspects of wrestling. Well, some of those professional wrestlers have had issues with their kidneys. You see how it can all integrate. So this having our information out there makes people curious. And then because of the wonderful digital age we live in, and because of how things are transmitted online, you can say, watch, this person's show about wrestling. Well, guess what? They're one of our partners, and our site mentions their show. That's going to get people to say, oh, what's a kidney contender? Wait, who's that? Oh, wow, look, hey, they're talking about kidneys. Oh, I want to go back to wrestling though, but I want to come back to their site. So I wish that more organizations out there that have the funding, that have the media attention, would do what we're doing. People want to learn. They may not want to sit there and read over and over or watch the same type of information about kidney health, but people are interested. You just got to be interactive. You got to care. So yes, I have seen small changes in the communities that we're a part of. I want to see more changes throughout the United States. I want to see more changes throughout the world. And so we're only 4 people, by the way. And our 2 volunteers, they do their best to just start looking up different events that are going on, people that are putting on events to make awareness about something they're passionate with, like Austin Fashion Week. Who would ever think Kidney Contenders has been a sponsor for the Austin, Texas Fashion Week? How the heck does that relate? It gets people interested and motivated. It got them so motivated, they actually decided, okay, you know what? We're going to start making a health-related concept with Austin Fashion Week. You don't know what bridges you can build if you don't reach out there. And that's honestly what I'd like to see more of with these more profitable organizations.
How does your organization help people find appropriate help and care when they're struggling with conventional medical routes?
We have an additional resources page that is a legitimate resources page. And so we have a site on there for clinical trials that are being done throughout the rest of the world, and not just the United States. We also have immediate resources for people that are facing issues with kidney health. Now, if there are more prominent health-related issues, like they need to see a primary care physician, because we're technically a virtual online with kidney focus, we can't just have like every primary care physician out there. But we do have a contact us page. So if our additional medical resources or, resources related to healthcare and wellness in general is not enough, contact us. Contact us, ask us a question, because myself and the 3 others are well versed in healthcare literature to be able to guide someone, not diagnose, but guide someone to a source to help them out.
And speaking of healthcare literature, I noticed that you have a ton of research citations on your website. Tell me about some that stand out to you.
There is a very good research being done right now. It's in phase 2, and it has to do, and it's actually from the National Institute of Health here in the United States. It's a small research group. They think they have found a pharmaceutical product that can actually help people with this rare form of kidney disease. They think that it will actually stop the progression of that disease. And it is known simply as manic. Now, that term actually means a lot more. It doesn't actually mean manic itself, but it is a longer term, but it's remembered as manic. And this rare type of kidney disease is something that most populations have never even heard about. And sometimes the function within the kidney, how the kidney actually works, because the kidney is both an organ and a gland. It produces hormones. Well, there's a lot of other things within the kidney that needs to be stable in order for it to be that quote unquote filtering system. And so one of the clinical trials right now going on is in phase 2. They need more participants, but there's a page on our website, and it's we have it abbreviated. It's FSGS, and what that is the focal segmental glomerulosclerosis. And sclerosis, just for your listeners to know, is anything that's hardening. So you've heard it used with multiple sclerosis and other forms of atherosclerosis. Sclerosis itself, the suffix, is anything that hardens. So this study focuses on a hardening occurring inside of the kidney. But this study is so unique that we just decided, okay, we're going to take the literature that they have and we're going to give it its own subpage on our website. Unfortunately, they haven't been able to get a lot of participants because we just found out that except for one other nonprofit, NephCure, and we're technically not a nonprofit, except for the nonprofit NephCure, we're the only other organization that's willing to help their group without asking for payment. They're trying to recruit participants for the study, and they're having a hard time doing that not because the literature is so hard to understand, but because the other nonprofits they've gone to that are supposed to be about helping people resolve these type of rare kidney diseases, they want to get paid. and they're not being paid. So we're helping them out for free. It's just a matter of how to translate that information to someone who might qualify for the study, but not understand what the study actually means.
What solutions could you offer to someone who's at a real crisis point in their kidney health journey?
If a person knows they're really at a crisis point, the only thing I can think of, Jahan, is that they're too scared to want to seek licensed clinical professional treatment, or they have, and they were so rudely interacted with, they just want some pills to resolve the issue they think will resolve their issue and move on with their lives. I'm going to say this. My mother, who has since passed, she died in 2013, not related to kidney failure. She actually had atherosclerosis. She was very scared. And I did my best to try to break down information to her as she was going through it. Once I started working in dialysis, I can tell you that it took one bad interaction with a renal dietitian, a licensed clinical social worker, and one of the licensed dialysis nurses to make her say, okay, I'm done. I don't care about this. I'm so tired of being poked with needles and told to do this, told to do that. I have to work a full-time job. I'm done. I don't care. She did come to me for advice because obviously I'm her daughter. She knows that I care about her health. I would say if a person is really at the end of their road with treatment and just help in general, I would hope, and I'm using this word correctly, I would hope there was at least someone somewhere that they trust, that they know, that they can talk to, who is going to listen to them and maybe really help them think differently. So instead of saying, I'm done, I don't care anymore, I'm going to do whatever I want, I don't care, no one cares, I would hope there was somebody they could reach out to who could say, hey, have you ever thought about maybe going to this person, maybe getting hypnosis, seeing what the underroot problem is? There are things that people can do to help them get back on track and focus on their health. But sometimes it takes them talking to someone that they trust to make them see differently. And hopefully that's a person who really cares about them, not someone who's going to say, you're absolutely right. Here you go. Just keep feeding yourself stuff that's not going to help you. Die quicker. I just hope that if they don't want to reach out to someone like me, someone who has a website, who has a contact us page, who actually cares about people, who can probably give them a different direction to consider contacting or going to, then I hope they have somebody else in their life that cares just as equally about their right to live.
So how can society make community health education easier to understand so that the information about prevention is more digestible?
They can stop lying. They can stop telling tall tales and stop rushing facts in front of people's faces to the point where people don't care. That's the truth. I mean, these events that get put on. Now, I will say this. You have nonprofits that have a certain amount of money that they're allocated through the state, through their city, through the federal government in the United States, and they will put on preventative education type events. Or for those that are already suffering from said illness, these events are to inspire them, to show others that, they can avoid the same fate that they're experiencing. The problem with a lot of these community type events depends on what the message is. Now, most health community type events are physical activity events. And so that gets the body moving, which of course is good for the mind. It's good for the body. But if you want to separate the mind from the body, it's good for the mind as well. Kind of like a puzzle. The problem is, are people really understanding what they're moving for? Are we doing all these walks, these runs because we're actually achieving something, or we just want to show off and show how talented we are at walking and running? Like what actually is the message? And I think it's because we're so integrated with the whole, if there's a walk, it's charitable, donate money. Don't bother walking, just give them some money. What's the purpose behind it? we have to do better. We have to actually care about what we're promoting. So I'm going to say something that your viewers may not be happy about, but I'm going to say it. I say stop just giving out 501c3s to every organization who wants to be a quote unquote nonprofit, and stop allowing them to hire just any old person who has certain academic credentials. Start really assessing if people actually care about what it is they're advocating for. You want to change something going on in communities? Get the right people in charge. There are people out there like me, and we don't believe in taking money from others, but we do believe in helping others. But we want to do it in a way that's safe and actually helpful. I'm sorry, I'm not going to go out there and ask you to donate your money or even your time if what I'm putting on is just because it's an institutional requirement. Sorry, I'm not going to do that. So if that means that we can't help communities that way because I'm not, say, willing to do what the institutional requirement is, then I guess I'll just have to keep everything virtual and find other ways to approach people. And maybe somebody in the future will have the same balls that I have, but be willing to spend their own money and have all the rules and regulations required for putting on community events to the public offline, and get the right people and have something that's memorable and sustainable.
You touched on this earlier, but I want to go a little bit deeper on how your own experience has shaped your understanding of what patients actually need versus what's available already.
Patients don't need to be told that their doctor is a licensed clinical professional with years of training. Patients don't need to be told that what they're experiencing is textbook. Patients don't need to be told this. They want treatment. Sometimes they want a shoulder to cry on. I notice I didn't say that earlier. It's not that I'm not emotional to somebody's need to emotionally unload, whether physically through crying or through some type of, even those that, go the artistic route. I guess for me, it would be puzzles, puzzle building, puzzle solving. I think people really just need to know that no one's judging them. I know that seems kind of idiotic to say because we're human beings. How do we not judge? But I think what people need, what I needed was to know that I'm being told the information. And this is not a quote unquote peeing contest. I mean, I remember being in the hospital room, having one specialist snap fingers at another specialist and say, "You're wrong. This is how it needs to go." I don't need to see that. I don't want to know that there's some type of animosity between your two ways of thinking. I just want treatment and good care. I also don't want to be asked how I'm feeling. Take a guess how I'm feeling. I am stuck in a hospital bed. I'm stuck in a dialysis chair. I am stuck with all the rules and responsibilities of just living. Don't ask me how I'm feeling. Show me what you can do to help me. Show me that you care that way. And I think the majority of people would agree with me on that.
I certainly do. But speaking of the artistic route, people tend to relate better to the things that bring them joy: music, art, even movies, and reading books and fiction and things like that, right? But you have a section on your website about music therapy. Tell me about that.
I didn't even think about music therapy when I was approached by a specialist who was an audiologist at the time. And they contacted me via the LinkedIn social media platform. And they said, "Did you know that music therapy actually helps patients that have chronic kidney disease?" I said, "Okay, you mean like they just listen to music and they feel better?" They said, "Well, actually, it reduces their high levels of blood pressure." And because that is, by the way, something that is always taken before dialysis begins for a patient, their blood pressure, they're the basic essentials that are talked about but are never really understood. Blood pressure reading is taken. And if blood pressure is too high, they might need a certain medication to lower it. But with that said, I had no idea that music therapy can actually help to reduce blood pressure. I had no idea. I said, "How is that scientific?" And so I started thinking, okay, so music therapy, but it doesn't have to be a specific type of sound. And then you think about it. Well, what about a lot of times when people are just listening to waves or a calm, soothing setting? How about that? How is that actually helping? Well, it's reducing stress levels. Well, what causes stress? And then you start looking at blood pressure. And so the person that I spoke to at the time, the audiologists, they actually specialized in how sound can either alleviate tension within the body or can actually cause more stress for the body, depending on how the sound placates throughout it. So a lot of times dialysis patients, for example, not all of them are sitting there watching TV. Some of them are listening to hypnotic therapy tapes. Some of them are listening to actual music itself. And some are just listening to a certain back and forth hum, but it keeps them almost zoned into themselves. That's probably the best way I can put it.
So what's the most important question you've never been asked that you would love to be asked right now? And the answer.
Why do you care? Probably. No one's ever just outrightly asked me, why do you care?
Why do you care?
Because even though I know the human body is made of cells and, it's up to interpretation of what happens once we expire in the physical form we're in, I care because I have no reason not to care. I don't have to know everything about you. I don't have to know everything about your audience. I don't have to know anything about everything because I never will. It's not possible for me to. But I have every right to care as much as I have every right not to care. I care because I can. And as simple as that seems, I've known people who have decided not to care. I've seen what happened to those people who decided not to care about themselves, about others. And they went down a very dark road. And it didn't end well for them. And since I personally knew them, grew up with them, went to school with them, whatever the case is, I can tell you that I have every right to care. And people don't have to like me for caring. But at least I'm willing to be part of a solution. I'm not trying to deplete a solution.
And I like that response because that's kind of the driver behind this podcast as well. The surface level discussions that are dime a dozen and everybody and their auntie and uncle and grandmother has a podcast now, but they want to talk about things in a way that are quite frankly empty and unhelpful. And I felt like one of the major things that's missing from this arena is people who actually give a right? We used to care about each other. You remember 20 years ago when we still cared about each other and we had more community? Now everything is just so I've got to get on to whatever the thing is that I got to do and see you later type mentality. Or I'm too busy scrolling on my phone type thing. And it's really good to care about people.
You said it all. I can't argue that. I can agree with it. I agree with it. I can't argue with it.
Well, Jen, this has been a very informative conversation. Tell everyone where they can find you.
Jahan, thank you so much for inviting me. And, just keep doing what you're doing. I know it's cliche, but really keep doing what you're doing. I appreciate it. My team appreciates it. I know the world does too.
Yeah, you are a savage and I got your back. Don't worry about it. Thanks for being on the Boundless Authenticity podcast. And for the listeners, if you want to help this show grow and you want to help Jen spread her message of Kidney Contenders and all that goes along with it, all you have to do is like and share this episode.